Caliber? 9mm. Range? 50 yards. Angle? I don't know. There's no exit wound. Bullets probably hit something. Like what? I want him intubated. Number 8. Endotracheal tube. Get ready to bag him.
Hi.
Estimated blood loss?
About 2 units.
I thought I saw you standing in the middle of the road.
See a drug user?
Hey, get up.
You hungry?
Time?
20 minutes down now.
It was as though I had known her forever.
Vitals?
EPA systolic, pulse weak and thready.
Why doesn't it have any sound?
It's broken.
How could you do that to me, huh?
What aren't you telling me?
I did it. I shot the son of a bitch. He was trying to kill me.
Not coming back to you. Why in God's name would you want her to?
She had the most beautiful voice.
Come with me!
I made a mistake once, and I can't make it again.
Come with me!
She's the only woman I ever loved. I put her in prison.
You're gonna regret it if you don't.
She's got a gun! You let the kid? Why? You might want to call somebody. He's okay, right? He's okay. He's breathing, right? When we know, you'll know.
I should be with her.
He'll be fine. Won't you, Ben?
Benny, I'll be right out here.
Give me normal saline, wide open.
The shooting team cleared you. That must have been reassuring.
Yeah,
How is he?
they found the bullet. In the T8 vertebrae, wherever that is.
The thoracic region.
It's too close to the spine. They didn't want to risk taking it out.
I'm told he's expected to recover fully.
Yeah.
Have you talked to him about any of this?
He's barely conscious.
Then you don't know how he feels.
Look, what's to know, okay? I shot him. All right, he's fine. I'm fine. We're all fine, all right?
Listen, just because you can see them and their blinds are open is not to be taken as an invitation. It's unethical. It's also against the law. Aside from which, you'll go blind. Oh, fine. Don't listen. No, you see, this is different. I have a wound that leaves me no choice but to face the windows. Oh, yes, I could close my eyes, but I'm not about to do that because I am not actually prying. Oh.
Cavs are gonna win this year. White Sox don't stand a chance. Did you watch that game last night? White Sox suck.
There you go, all hooked up.
Doesn't this thing come with an automatic horizontal hold?
That's extra.
Extra.
Want to press the red button?
Hey, this thing's broken.
Hey, it's not my department. Call 217 for service.
It was never working in the first place. I finally get you to say yes to the damn thing, and it's broken.
3 weeks. 21 days staring at beige walls with beige linoleum day in and day out.
You know, you can leave, Ray. I mean, you don't have to come here every day.
I know that.
I mean, you have a job. You should go to work.
I do go to work.
When?
When you're asleep. You do that a lot, you know.
Oh. Still, I think...
Look, you start your physical therapy, you get your sea legs back. In the meantime, we get through this the only way I know how. Baseball.
Who's playing?
Who cares?
This is great, Ray. Thanks.
Don't they have rules about this sort of thing?
The nurses have all taken pity on him. They feed him, they water him, they walk him regularly. They like him, he likes them. He eats better than I do. I think he's even happier here. Ingrate.
They haven't found her, you know.
The investigation?
Officially, it's still open. Unofficially, it's on the back burner. The diamonds were recovered, and the murder victim is a convicted felon. For all we know, she can be in Afghanistan.
I still see her. I'm not sure what I see, actually.
Well, you know, those painkillers, they can do it to you. What? Look, no more, okay? It's gonna make you fat.
Get her in his chair.
Oh. Okay. I'm gonna get out of here. Can I get you anything?
No, you've done more than enough already.
Hello, son.
You gotta stop doing that.
More boring the other way.
Couldn't you just have sent some flowers or a card?
You're just mad because I didn't get here sooner.
No, relieved is more like it. If you had come sooner, I might not have been able to tell which one of us was actually...
Dead?
Yes.
Well, it's not a dirty word, son. Besides, the worst things than being dead...
Oh, really? Like what?
Well, you, for instance. You wouldn't catch me moping around here because I was shot.
I suffered massive nerve and muscle damage. I was lucky to survive.
I'd have been back on the post next morning.
I hardly think so.
You've been lying around here for 3 weeks. Can't stay in this bed forever, you know.
I don't plan to. This is called recovery. I am recovering.
Oh. She got you good, didn't she?
No. I was thinking of going home.
To the territories?
I thought I'd rebuild your cabin.
Huh. Whatever for?
Robert!
Oh, my God.
What?
Here. Tell him to put these on the warmer.
It's 70 degrees. These won't do him any good.
Who are you talking to?
You don't see her? No. It's your grandmother. She brought you some pajamas.
Oh, well. Thank her for me.
Of course.
Anybody else drop in?
No, not so far.
You're babying him, Robert.
He's been shot, Mother.
Can't stay in bed forever.
You didn't see her?
How is she?
She's not dead enough, son.
Am I interrupting?
No. Come on in.
Jill Kennedy.
Yeah, from the
From the-
hospital.
Right, I'm the...
Physiotherapist.
You recognize me?
No, actually, that was, deduction.
You deduced me.
Yes. Yes, I did. You see, your hands, although small, are...
Excuse me.
Uncommonly muscular, as are your triceps, biceps, deltoids, pectorals, latissimus dorsi, and abdominal rack. This is not something you'd ordinarily encounter in a nurse unless she was accustomed to heavy lifting. Also, there is...
May I?
About you the scent of eucalyptus, which is a very common ingredient in muscle lineaments. And that is mixed with, I would say chlorine, which I imagine would be from the whirlpool. And on top of that, there is coconut. Hand lotion.
A shampoo.
Ah, there, you see. Well, all of that's very consistent with a physical therapist who has very, very clean hair.
That's quite a talent.
I'm sorry.
That's okay. You're a policeman, right?
Yes. From Canada. Royal Canadian Mounted Policeman.
Oh, that would explain the bowed knees.
Bowed?
I'd say 5/8 of a centimeter. A quarter horse, 16 hands.
As a rule?
Well, you've got quite a few mementos here. Left leg's been broken and reset. Twice. The second one was pretty nasty. Fell, what, 50, 60 feet?
57.
Off a building?
Off a cliff.
Somebody pushed you?
I jumped, actually.
Oh, that would do it. Oh, serious knife wound. 7-inch blade, serrated edge. What was he hunting?
Me.
And this is recent. A minor laceration. It's small but deep. Glass door?
Tempered.
Ouch. And this is interesting. It's old, maybe 20 years. There's plenty of scar tissue, so it was deep. It's an object, but something soft with teeth and hair, maybe? This is going to sound really silly, but were you ever...
It was an otter. I was 10. It was dead. Someone hit me with it. Can we move on?
Okay. You ever going to use this thing?
Thinking about it?
Keep thinking. 3 months. Start using a couple of weeks. Sure.
Oh, I'm sorry.
Oh, that's okay. Cold hands. Another hunter?
A friend, actually. He was aiming for someone else.
Who?
A woman. She had committed a crime and was attempting to escape. He drew his weapon.
And you just happened to step in between.
Yes. What?
Nothing. You just don't strike me as the clumsy type. Nice pectoral muscles, don't you think? What is it?
Photographs.
Well, it is kind of mesmerizing. Feeling all right?
A1.
Blackmail.
Excuse me?
Can I grab a hand? Of course. What else could it be? Tell me if this is painful. You'll tell me? You saw the photographs.
Well, I didn't see what was in them.
You saw how she reacted.
Well, perhaps it was a sad occasion.
That's what a person does when she sees sad pictures. Burns them. So what else did you see?
What?
You've been lying there staring in those windows for 3 weeks. What else?
Oh, I guess my mind was elsewhere.
Elsewhere. Like, you don't want to talk about it. I get it. That's fine.
No, I think I'd
That's
pretty
okay.
much...
We can just keep this simple. You're the patient. I'm the physio. We don't talk. No problem.
Okay.
Time's up.
Ow.
You're kidding.
Oh, I'm sure it's nothing.
A surgeon with a needle in her thigh? That is not nothing. It's drugs. And if it's drugs, that is professional misconduct. Malpractice suits from every person she's ever treated.
You said there was a photocopy room next door. Maybe someone was making photocopies.
At 2 in the morning?
As for the injection, she could be a diabetic or taking some other kind of medicine.
She's a junkie.
Look, I think before we leap to conclusions, we should take a deep breath and... You're being unreasonable.
I am being perfectly logical. What we saw was a rich doctor with a drug habit who's about to be blackmailed.
No, what we saw was a woman opening an envelope and burning the contents. We have no evidence an actual crime took place.
Okay, let's get some. I have a friend in maintenance. He's got keys to all the offices.
Miss Kennedy, is it your custom to incite all your patients to break and enter?
No, do you usually ignore a crime that's taking place right
I am
now?
not a police officer in this jurisdiction. And even if I did have the authority to investigate, I've taken a leave of absence.
Are you okay?
Mm-hmm.
Are you sure? Throw in the towel, huh?
No, as you can see, I just need some time to recuperate.
This? Oh, this will get over in no time. The other thing, well, maybe you're right.
What do you mean?
You know the thing that we're not talking about? Some guys never recover from that. One good punch and they're knocked out cold. Never recover.
I have no idea what you think you're talking about.
Of course not.
She's a lovely girl.
She's not a girl, she's a therapist.
Excuse me?
And one of us is going blind.
That's nothing.
Still, I suppose it is your choice.
What is?
Well, you can ignore it if you want to, but she's just not going to go away, is she?
By the way, son, could you see your way clear to thinking of me in a pair of trunks?
Do you mind?
I mean, every time you open your eyes, she'll be right there.
All right, that is enough. Thank you, Miss Kennedy.
Jill.
Jill, you're a very fine physical therapist. I have no doubt you're a very fine, caring, and decent person. And while I appreciate that, I would appreciate it a whole lot more if you'd confine your comments and advice to matters directly concerning my physical well-being and you left my personal life to me.
I was talking about the doctor.
Oh, well, that's a completely different thing.
It is true, though.
What is?
I do hate to see a good man go to waste.
Oh, Rosemary, I love you. I'm always dreaming of you.
Ah. It's a power saw.
So it is.
Top of the line, guaranteed not to rust with a lifetime warranty.
What's it for?
Your dad's cabin. I thought we'd go up there together and I'd help you rebuild it.
Oh. Ray, you hated that cabin.
No, I didn't. I just hated leaving it to go to the can, which brings me to this. Pick one.